Hi, this is Dr. Taylor. I'm here with another edition of our TOAH Talk Tuesday. Today's subject is bloat and what causes it and what we do about it. Bloat, or gastric dilation, is when the stomach gets overly full of food, of gas, and it's unable to empty. And so what will happen is these animals will be in distress. They're obviously restless, they're salivating, they're nauseated, they're trying to vomit. Oftentimes they're retching, but nothing's coming out. It's this non-productive vomiting, and they will have this bloated looking stomach, especially as all that gas fills up. If it progresses, it can become an emergency and life-threatening. The stomach sometimes will go through volvulus, or it twists around on itself, and then the gas expands more rapidly. You can actually have shock happen, cardiovascular distress, splenic issues, all kinds of things. So, who is at risk? Large breed dogs, and especially giant, deep-chested dogs. If you have that long chest that's not very wide, a Greyhound, a German Shepherd, Great Danes for me are the most classic standard poodles. So those guys are at increased risk. There's multi-factors to this disease, it's not just one thing. What some people feel like can be additional factors are a raised food bowl, can actually increase the risk. Dogs that are nervous or anxious can actually increase the risk if they eat too fast, potentially. The things that everybody definitely agrees on as factors are if you are a breed at risk, if you've had a family member, so a primary relative of the dog, a littermate, a sibling, a mother or father who has had the disease before, is a big time risk. And then eating a single large meal, especially of dry food, really predisposes you to this. That dry food actually expands like 3-4 times its dry size once it gets in contact with the water in the stomach. So if it gets overly distended and the stomach can't push it forward, then you can really run into trouble at that point in time. So risk factor wise, we know now, like, what can we do about it? Well, in the event of an emergency, we can certainly fix it. We can try to get a stomach tube in there under anesthesia, get the contents out, and then oftentimes proceed to surgery. And the surgery is called a gastropexy, where you make an incision on the stomach and you attach it to the body wall, like the inside of the rib cage. And that doesn't allow the stomach then to flip on itself and cause those problems going forward. So the other things we can do is feed smaller meals more frequently, and especially if you have a Dane, if you have one of these at-risk dogs, you want to feed not one single meal, especially of dry food, but potentially you could mix some canned and dry, and that way that'll reduce the overall bulk of the food. And then sometimes we can actually do that gastropexy prophylactically. So if we have a dog who's at risk, we know again their risk factors are high, we can do that surgery, for instance, when they're getting a spay done or when they're getting a neuter, they're going under anesthesia for some other reason, and that will decrease the risk greatly, and they will not be able to have that flip and get into an emergency later in life. So hopefully that cleared up some things, and I would say a little bit of a confusing disease because there's so many factors that go into the causes, but I hope that helps, and we will see you next time. Thanks.